Hi everybody, I'm Marla with 9 Health, and we have a really special treat today. It is Buddy Check 9. Every 9th of the month we ask you to reach out to your friends and partners and family, people you care about, and remind them about some of the health issues that we can actually take action on. And this month is cancer prevention. And so we're going to look at all these experts we do have. Come on, this is a great day. And so they're going to be answering questions here at 9 News live on the phone, and you see some of them already. But we're also going to take your questions. So if you have a question, and we're going to learn from all sorts of experts. We have lung cancer experts. We have, heart experts. Ask us your question. If we can't answer it, we'll type it in. Okay? So let's just get started, and right away, we want to talk to our experts and find out, because cancer is a big, scary word. The C word, right, you guys?
Right.
And so when you say the C word, that's because it's the second leading killer among all things. So, and you, I know, specialize with lung cancer, but cancer in general. There's some things you can do to prevent it. Yes.
Yeah, absolutely. Thanks so much. I'm Marcia, nurse navigator at the Medical Center of Aurora.
Yay.
I am a lung cancer navigator, and you're right. Cancer is a huge problem, and the one thing about it is that so many of us haven't stopped to think about what really is there that I can do to prevent that.
Right, we think it might be inevitable.
Exactly.
But it's not.
It might just be in my genes, I have it coming my way, but in all reality, we have a lot we can do differently.
That's great.
Stopping, thinking about our lifestyle, what we're eating, if we're exercising or not exercising, and most importantly, we know now that screening saves lives.
Yeah.
And that's one of the things that Amy actually knows a lot about, that I'm going to kind of pass it over to her. She's our screening expert at Medical Center of Aurora.
So before we move on to screening, right, you said some really important things. There's some things in lifestyle you can do
Yes.
to really reduce your risk for cancers.
Yes.
And how effective are those preventative measures? I mean, sometimes we always hear people say, oh, you better eat well and you better exercise, but is it really going to help me reduce my risk?
It actually affects things in an incredible manner. Even if you were to get cancer, even if you were to get heart disease, the more you put an effort into your lifestyle, being a good lifestyle, eating healthfully, sleeping correctly, getting your sunshine, eating correct foods, as I already said.
Can't say it too much, though.
Exercising.
You can't say it too much.
You can't. Those kind of things make a difference, because when you get sick, your body is going to actually respond better to treatment because you actually were on top of it. So
That's
it does
such a good point,
it does
too.
save lives.
It does.
It really does.
Really, really great. Okay, so we were going to talk about screening, and you know about a particular kind of screening, this lung
Absolutely.
screening.
Yep.
So really, really important, because lung cancer is, you were just telling me.
Right. So we do have lung cancer screening that we offer at the Medical Center of Aurora. It's great because you get to have me as a nodule coordinator.
And you look really nice
Oh,
and,
thank
and
you.
professional and, smart.
Yeah, exactly. Thank you.
Don't you agree?
She is.
Yeah,
Actually,
she's really-
Amy's phenomenal.
Thank
you actually asked about how prevalent, in a way, lung cancer is, and it actually is the #1 killer of all
Ouch,
cancers,
yeah.
which
Yeah.
is a big deal.
Yeah.
And so screening is so important.
Right.
That's why we are so glad we have Smart Amy.
Yeah.
Beautiful, smart Amy. Tell us about screening.
So there is a little bit of a criteria that needs to be met. You have to be between the ages of 55 and 75, asymptomatic, so no history of cancer or certain symptoms, which you can check with your primary care about to see which ones those are. You also have to have a smoking history of at least 1 pack per day of cigarettes for 30 years.
So that sounds like a big risk factor, smoking,
Yes, smoking is absolutely the biggest risk factor.
for lung cancer. Not the only one, but a big
Right.
one. Right.
And then, so we work with your primary care office to get you an order, and you can come in and see us, and we'll get you screened. They'll do
What
a
is
CT
it?
scan.
Oh, okay, it's a CT
Yep, it's a
scan,
CT
okay.
scan with no contrast, and they'll screen the lungs, and then you qualify to have a screening every year thereafter. We'll put you in our database and make sure that happens.
Yeah. So, and if you catch this cancer early, it's much more treatable. Is that right?
Yes.
And that really is actually how we are finding a cure for lung cancer today. Lung cancer was one of the cancers that we've not had a cure for in the past years to
Right.
date. But we are actually finding a cure with it today with the fact that we're getting screening done.
Okay, we're going to
And
be on
we
air
are-
in a minute, so.
And we are finding it early enough that we can excise it and cure it.
Yeah, so that's great. So you are finding cures.
Yes.
That's really great. Now, if you're just joining us, we're talking to the plethora of beautiful, smart experts that we have, and we're talking about cancer prevention today. We just talked about lung cancer prevention and screening. We're going to move on and talk a little bit about how genetics plays a role in that. And we're going to, if you have questions, right, there are things you can do to prevent cancer. We heard about some of them. Some of them you've heard about a million times, but they really do work. We're hearing from the experts today. They really work. So if you have a question, you can type it in. We'll try and answer your question. People are going to be calling here soon, and they're going to be answering questions on the phone, so we're going to fit in your questions too. So we, like I said, one of the risk factors, right, is genetics, is your family history. And so we're going to talk a little bit, and please introduce yourself, Michelle.
Yes, I'm Michelle Springer. I'm a genetic counselor with the CU Cancer Center. I work with the Hereditary Cancer Clinic. Okay. And what we do is we see individuals with either a personal history or a family history of cancer where there's concern that there could be an inherited component to the cancer in the family. We know that about 10% of all cancers are inherited, and so identifying those individuals and other families who could have a higher risk is really important from the screening and prevention standpoint.
So 10% of cancers, you say, have that genetic component. Yeah.
About 5 to 10% of all
So we're getting
cancers
questions, you guys.
have an inherited component.
Okay.
And
Buddy check now.
when we talk to patients, we think of three main reasons why that information is important. It helps us understand why that individual developed cancer, why there's a pattern of cancer in the family. Many hereditary cancer genes have risks for multiple types of cancers.
Oh, I was just going to ask you that. Are there certain kinds of cancers that are more genetic or run in families more?
Yeah, and that's a great question. We know that about 10% of all breast cancer is inherited.
10%.
About 20% of all ovarian cancer is inherited.
It could be a number of different things. It could be the
What
medicine you're
qualifies as a
taking.
family member?
So
I would
typically
definitely
we're looking
do
at
you have a
the
primary
entire
care
family
doctor
tree.
that
We're
you
looking
visit
at
often?
first degree relatives.
Okay, he's going to be the
parents,
best bet
siblings,
to find the actual
We're
problem
looking
for
at
that.
second degree relatives, so
But yeah, I
aunts
mean,
and
it could be a
uncles,
plethora of things,
grandparents, nieces
too
and
many to
nephews,
name.
and then also
But I would definitely call the primary care and
we're
let them know
kind of
what's
looking
going
for
on.
patterns of cancer in the family to
Okay.
see if there could be something.
So let me get this
All
straight.
right,
If my
thank you.
cousin
Bye-bye.
has a cancer, I might be at more risk. Should I worry?
It depends on the. It's
complicated,
It
huh?
is. It
Sorry.
is. And what we're doing is we're looking at the ages of onset. We know that individuals diagnosed with cancer at a younger age, it's more likely that there could be an inherited component. So seeing breast cancer, say at the age of 30, is more likely to have an inherited component, especially if there's a family history, versus say an individual who's diagnosed at the age of 70 where there's no history. That would be more likely to be
Okay, sure. So you guys see, we're answering all these calls, right? People are calling in, answering their questions. You're welcome to type in your questions, and we have experts. And Michelle, you're a genetic expert, counselor. And so that's really interesting to us because I always wonder if, running in families, cancer, if we should worry and should we get screened earlier and should we take even more care to do preventative measures? What would you say?
And that's a great question, and that's
That is
probably
a great
the main
question.
thing that we
I
talk
think
about.
that's pretty
With about
specific
10%
to
of
what
all
a doctor
cancer
would
being
probably need to
inherited,
answer for you.
It's really important
it
to
would be too hard
identify
without
those
knowing all of your
families.
history
So
to be
knowing
able
that family
to give you
history
any valuable
and
information
evaluating this family
if you want, you could definitely probably call the cardiologist.
Do you think most people know that cancer there could be a genetic component? Do you know that now?
I think more people are hearing about it. Angelina Jolie, a few years ago, kind of brought a lot of this to the limelight when she talked about how she had prophylactic surgery because of a hereditary cancer gene. And that's really what it's all about, is having this information and using it for earlier screening, detection, things like that. There's a lot that we can do differently if we identify a high risk in the family.
Okay, well, so that's really good news. There are things we can do. We mentioned earlier about lifestyle and how that really does make a big difference. And the thing that I heard, well, you go ahead because you're the expert.
Physical activity.
Physical activity.
Physical
really
activity is one of the biggest things that we talk about. The American Cancer Society recommends 150 minutes a week. So it's about 30 minutes 5 times a week. Doesn't necessarily
seem like that hard, but sometimes it is.
But I would think
and you know, we tell individuals you don't have to go to the gym. Really just getting on your walking shoes, going for a brisk walk, and getting your heart rate up.
Getting your heart rate up is important. Yeah. So even if you're just doing a little dance in your house for 30 minutes.
Dancing with the kids.
I mean, there's ways to get it in, right? That don't require a gym membership, walking the dog. Yeah, I've seen even videos where they have
worried,
peach cans or whatever, and people are kind of lifting those. So I mean,
or doing things at work.
So very good, very good. So this is really great. I don't know. We're getting so many questions here, you guys, that I don't know if we're going to get to talk to everybody. But if you have a question, you have a choice now. You can either type it in and ask us, and we'll get your questions answered, or you can give us a call because it is Buddy Check 9 today. And we're talking about cancer prevention, and we want everyone to know that there are things you can do to reduce your risk of cancer. Some might be 10% about are genetic.
Knowing that family history is really important.
The key. That's the key.
Knowing your family history, living a healthy lifestyle, exercise, obviously avoiding things like smoking.
That's the number one thing. And I heard it's really, really challenging to quit smoking. So, but if you can,
there's a lot of great resources. A lot of the hospitals have different programs that can help individuals with that.
Would you say that's like the number one thing if you can do to try and stop smoking if you're a smoker?
That is probably the biggest thing.
Yeah. So there you have it. The experts will tell you, right? Okay, and the other thing I want to remind us of is that 9 Healthcare, we do have screenings that can help with some of these cancers. Cervical cancer, certainly, with the Pap smear, which is the gold standard for finding that disease. We have colorectal kit that you take home. It's all in the privacy of your own home. We have breast exams. We also have blood screenings that can help find blood cancer, blood cell count. So if you're interested in that, please go ahead and check it out at 9healthcare.org. If you have a question for us here, these experts who are answering the phone, we will take time and we will answer your question as well. So please type us in your question if you do have a question. We're going to go ahead and sign off because they're so busy. But thank you for joining us and have a great day. We'll see you next time.